This is a O3UV treatment for large animals. We've got some specially designed equipment for it in the bags and the different materials that you're going to need. So let me just start introducing that. This is the GHL 3000. It is a UV unit, a UV purifier for the ultraviolet blood irradiation. This is just a peristaltic pump. You may have one in your office already. We make these available, or we sell them, so if you're interested, let us know. They're fairly low cost and they work well. You're going to need a cuvette. This cuvette is the Turbo 180. It's a new cuvette with larger diameter, and it'll work well for the large animal. You're going to, if you're using ozone, of course, something to collect ozone. We do have an ozone bag here that can be used, but you can use syringes too. Anyway, you can get 250 mLs of ozone in. And we've got a syringe, and this is a 14 gauge needle and some clamps. So those are the materials you need. You might need this too. This is just a two-way line, so you can buy a bottle of 1 liter saline. Because what we're going to do is we are going to put 1 liter of saline into this special O3 Vets bag, and then we're going to add the blood here and a little anticoagulant. And then we're going to allow that to flow through the tubing, through the pump, which is going to circulate, and then through the machine. It does take about an hour and a half to circulate, but it only takes about 5 minutes on the front side and the back side with the animal. So it shortens the procedure. Basically, while it's pumping, you can just let it go, and it'll just continue to pump, and the animal is not hooked up at this period of time. So what we're going to do at this point, if you use your transfer and you get your saline into this bag, however you want to do that, what we're going to do then is we are going to take this and go out to the animal. This is a 14 gauge needle, and usually you're working with a port, something that you put into the animal, or you can just use the needle itself. And we are going to take this and we are going to put this into the animal. Then we're going to lower this bag, and we need to get that down low enough. Now maybe you have a tray or a small cart. This will go into the animal. And our clamp will come off, and we're going to take this down here, and we're going to take that 3 to 4 minutes it'll take to get 250 milliliters added to this 1,000 milliliter bag. So we'll have 1,200 milliliters total when we get done. Well, we're done collecting the blood. We've got 1,250 cc's of liquid in here, and again, you've put some heparin or some anticoagulant in this. The problem is this tube area here has whole blood in it that is not got any anticoagulant in. And what we can do then is just pick the bag up, hook the tube, take the cap off. I'm sorry if you didn't see that. Hook the tube up, and now we've got kind of a closed loop unit. We could actually take this into maybe an office area if we wanted to get away from the animal, go in somewhere maybe where it's warm, and set this up like this, but we're kind of a closed loop unit. But one of the issues that we have is that we have whole blood without any anticoagulant in here. So what I'm going to do is I'm going to clamp on this side, and I'm going to take then a regular syringe, and I am going to enter the port, and with my roller clamp open, I'm going to draw liquid. You can see it flowing here. About 20 cc's of liquid. Now this is actually whole blood right now, even though the color is a little different. Just imagine it's whole blood. There we go. I'm going to shut the roller clamp. Now this has now got diluted blood that has anticoagulant in, and take off that clamp, and I am going to now roller clamp that shut, and I'm pushing this blood saline mix. You can see it coming out the top here. This is part of the unique circulation system that we've got, that the blood then will be able to circulate that way for a period of time. So now we've got diluted blood saline mix with anticoagulant in this whole unit, and we're going to now take this into where we're going to work. Now we're all set up here, so I'm just going to carry through the process here. Make sure your clamp is closed, and what we're going to do then is take our cuvette, and I am going to hook this cuvette up to this. And just to give you a little better picture of how that works, you need to tip the bag up so we don't have any fluid rolling out. All right, and then what I will do is I will hook the end of the cuvette to the tube. Now you can see we've got this tubing that needs to get the fluid flowing through here. So what we're going to use is our infusion pump. First I'm going to put this into the machine. It's fairly easy to put in. It's got some real soft areas of plastic right here. And I'm going to check the machine to make sure all the lights light up, and they do. It takes 3 to 4 minutes for that to get full power. Now we want the blood to flow this way. As you can probably tell, this pump pushes it downward. So I need to take my tubing and put my tubing into the pump. Get it all nicely tucked in there. And our pump we've got set, and this is what it should be, as 800 milliliters per hour. You're running somewhere around 12 milliliters per minute. And we've got 1,250 milliliters that we want to circulate. It accurately says it's going to take 94 minutes. So what we're going to do then is start the pump.
Infusion begins.
Now there's still one issue that we have to do. We're going to do that right now. Even though I showed you how that goes in, it really is best if this is held up like this as the liquid goes up through the tube, because otherwise there will be bubbles that get trapped into here. So we just have to hold it here for probably 20-30 seconds as the liquid now is being forced. The air, of course, is coming into the top of the bag here. That's not a problem. And I'm almost done. As soon as it gets to here, I can just put this back into the machine. All right, and that's going to continue pumping as I place this back in the machine. Close the lid again. Now we've got approximately 94 minutes. It's treating the blood as it goes through the machine, and we can go take a coffee break. The animal is free to roam in the pen or wherever you have him tied up. He's not going to go far if you have a port in him. And that's the procedure of getting the blood treated. All right, we're done. We've done the 90 minutes and we're ready to get this blood saline mix back into the animal. I'm going to take the line out of the pump now. I can certainly turn my machine off. I'm just going to set that out of the way. And what I'm going to do is I'm going to first off clamp once to the machine, and I'm also going to roller clamp this shut so we don't have any blood flowing anywhere. And I'm going to unhook the blood on the machine side, and I'm going to take my bag again, unhook here, and hook back up to the itself is what it is. And then I've got my cuvette here. I'm going to hook it to itself. And now I've got a closed unit. This can be just disposed of. Take your clamp off. This can be disposed of. Now we've got our blood all ready to go out to the animal, except we have to add ozone to it to give it the final therapy. So what we need to do now is we have a bag that already has, we've collected 250 mLs of ozone in here. I have a little clamp on it that's clamped it shut. As I roll this up, these are increments 200, 400, and it actually goes up to 750. So if I roll my bag up, you can see I have just a little bit. Here's 200. I've got a little bit over that, so somewhere around 250 to 300 cc's of 50 gamma ozone. I'm going to put a needle on that. We're going to go into our port with the needle. I'm going to raise the bag up just so I don't get fluid in it, and I'm going to unclamp. And now what I'm going to do is just slowly push the ozone into the bag. until I've got all the ozone out of here. You could use 4 syringes, 60 cc syringes, to get that amount in there. Okay, I'll clamp back up here, pull my needle out. I put my ozone in the bag. May want to massage it gently, just a little bit, to get that ozone into the bag. Now this is ready to go out to the animal. What I'm going to need again is my 14 gauge needle. My roller clamp is shut, so I could put the needle onto the end of this, and then we're going to put that back into the port. And you'll let this drain as fast as you want to let it drain in. It should take 4 to 5 minutes to get this back into the animal. So it's a wide open, let it drip type situation of getting it back in. On a 14 gauge needle, that's what we've clocked it at, is 4 to 5 minutes to go back in. So we had the animal tied up for 5-6 minutes at the beginning, and we have them tied up for another 5-6 minutes at the end, and we've probably got 5 minutes of messing around getting this all flowing. So in 15 to 20 minutes of your time and the animal's time, and then let this run for an hour and a half, you're going to get a good O3 UV treatment.